Thank you so much, Joe. Our next event is the patient panel, and I think this is an important conversation. I think just as humans, whenever we do something difficult that we've never done before, learning about other people's experience with that is something that most of us seek out, that gives us comfort to understand how that path will move forward. I know that as far as the internet goes, that's usually something that our patients search for. All over the internet, our caregivers are up late at night looking for that information. So we wanted to create this conversation today. And remember, there are so many of us in this room, but this information and this content is also live streamed. And then will be posted on our YouTube channel for all of the new patients who are searching for that information late at night. So keep that in mind. We have a panel here. Mary, I would like to invite you up to the panel desk. Locke, I can't see you because there is a column. And also Bill. Is Bill in the room? He is. Come on up. So yeah, there are a couple of mics here, and then there's a podium mic, and also we have a roaming mic, because what I was hoping that we could do, and Bill, if you feel comfortable standing at the podium, sure, that would be great. Or yeah, we can get another chair. So I would like for you to start by introducing yourself again. Remember, this is live streamed and will be online, so think of that as you share. But then I would also like to open it up to the audience to ask questions about your experience and maybe create a conversation as well. We do have a mic because it's live streamed. Just make sure when you're speaking from the audience, raise your hand so I can bring you the mic so folks at home can also hear us. Thank you, and let's just go in order with the introductions.
Oh, okay. Hi, I'm Mary Jack. I live in the Los Angeles area, and I was diagnosed with pleural mesothelioma just shy of 2.5 years ago.
My name is Bill Ziegler. I was diagnosed with pleural mesothelioma in 2011. I currently reside just north of Detroit, Michigan, and have gone through multiple treatments, finishing up in 2012.
My name is Locke Ta. I was diagnosed in April 2021 with pleural mesothelioma, and actually peritoneal also. And I want to apologize. We have to catch a flight, so I probably have to leave a little bit early.
And Meg here will take your place once you have to go.
Great.
Perfect.
Well, I'll sit up here and then
So,
you know.
So the next question, if you could talk about your diagnosis and then just sort of the meaningful steps that brought you here.
Great. Can I start? Yeah. When I was diagnosed, like a lot of people I've met over these past few days, I had a cough. And the cough was getting worse and worse. It was in 2021 during COVID. So I probably had about a dozen COVID tests, and it was not COVID. It was not a good time to have a bad cough. My primary care physician was treating it as though it was allergies. I had pills and inhalers, and nothing was working. I finally did get a CT scan, which uncovered some blood clots in my neck, which sent me to the hospital, which uncovered a pleural effusion. Many of you have talked about having a lot of liquid drained from around your lung. I had that, and was sort of one thing led to another. The cough was due to an enlarged lymph node right here in the front, which was impeding my airway. So that's what we biopsied, and that discovered the mesothelioma. And then, we took it from there. It was pretty shocking. There's nothing in my history that would suggest that I would be someone who would get mesothelioma. And I've heard that a lot the last few days as well. But I received great care from a team at UCLA in the Los Angeles area, and I'm so happy that I found the foundation. I found the foundation. I was at an infusion appointment, and I was sitting next to a fellow who was kind of eavesdropping on my conversations. And he leaned over to me and said, are you in any support groups or anything? And I said, no, I really haven't pursued that. And it was probably, almost 2 years since my diagnosis. And he said, you really need to do that. When you go home, go online and try to find support groups. And that's how I found the foundation. And I'm glad I did.
Yeah, I think that there's a little bit of a similar story for myself. One of the things that I found was early on during my diagnosis process, it was very difficult to pinpoint exactly what was wrong at first. And through time, I was able to finally get confirmation of diagnosis of mesothelioma, which took about 3 weeks because I was so young. They really didn't believe it was what it was. And once I got that diagnosis back, it was very difficult for me to know what path to take. A standard of care was handed to me, and the steps in the process were pretty outlined. So was the mortality rate, which just wasn't acceptable to me at the time. So I turned to different resources that could maybe help me out. The only thing that I really knew about mesothelioma was what I searched online. And when I searched online, I found marketing websites that really weren't helpful. I went down to my local cancer organization and resource center within the hospital, and they had very limited information specific to mesothelioma. So through continuing to Google on page number, I think 10 or 15, I found the Mesothelioma Applied Research Foundation, which really is your one-stop shop for everything that you need. And I was fortunate enough to get in contact with Mary Hesdorfer at the time, who is a wealth of knowledge and just has all the resources at her fingertips and has such long tentacles across the nation that she's able to really pull medical professionals together and really talk about patients and really help patients as well. So I think getting to the foundation can be difficult, but once you get here, it's very worthwhile your effort and can help you improve your treatment outcome.
Bill, how old were you when you were diagnosed?
I was diagnosed when I was 33. I remember it was July 2011. My birthday is in July as well, so happy birthday.
My name's Locke. There are two messages I actually want to get out before I go, especially to people online, because everyone here, we've already heard all each other's stories. One is that it's an extremely lonely disease, and I want you to know you have hope, okay? Because when you're first diagnosed, if you're like, I think most every story I've heard, it's likely a doctor that doesn't know about mesothelioma, and then you do the Google search, and you're like, damn, I'm toast, right? And so I just want you to know that that is not the case. Every person here and every person I've met with meso has an individual story and a different type of disease, and it's unique. So you just kind of have to forge your own path and kind of figure that out. So please, have hope. I was given 12 to 18 months when I was diagnosed. I went in for 2 collapsed lungs after I had vacation in Hawaii, just coming out of COVID. And I was a pretty active person. I thought I had asthma, blah, blah, now you got stage 4 kind of a thing. I have tricompartmentalized in both lungs as well as peritoneal. So that was even more lonely because some people were like, I only have peritoneal, I only have whatever. I was like, dude, I have both. I'm super screwed. And so, but here I am 2.5 years later, right? I was diagnosed in April 21. The other thing I think that's not said, I think that was very helpful. Actually, I have 3 things. One is NIH is totally free. They can't say that, so I'm going to say that for them, okay? And because this is an expensive disease. If you are on the West Coast like us, there's no really center of excellence. Most care is in the East Coast or whatever. And I'll just say there's different centers that kind of describe themselves as if like the place to go, but they won't take insurance. And there's just a lot of options out there, you know, the foundation, there's people, everybody wants to help, but NIH is also free, FYI. And then do your genetic testing, right? And the last thing I will say, I think that would make such a difference, because at the beginning of the disease, it feels like a death sentence.
Sure.
I mean, you're just sitting there staring at the ceiling, trying to figure out what you're going to do in the next 12 months to prep your family, right? And I'll tell you now, I walk an hour a day, I'm under no treatment and surveillance, and I still Peloton, right? And so I'm not going to be running any half marathons or anything like that, but there's hope, so you just don't know your situation. What was the third thing I was going to say? Oh, MARF. Okay, you've got to get into this Facebook group, because if you're like me, I just like to lurk, and when you're sitting at night and you're freaking out, it's really helpful to hear from other patients, because this disease is, to me, more art than science. I mean, if you look at it, over 20 years, there's only 2 FDA-approved treatments, right? And everything else is kind of like throwing stuff against the wall. And so to hear from other patients, I think is really, really helpful. So I would encourage you to kind of get into that Facebook group, even if you don't Facebook, okay? Because I don't. But that group, super duper helpful. So that's it.
Yeah, I just want to reiterate what you're saying. I'm all about resources management and being able to have something to take out of the back pocket and go.
Yeah.
And sharing best practices among patients is one of the #1 ways to do that. And for those who don't know, I put on the monthly patient support group, or the forum, if you will. And it's been very helpful for not only me, but through feedback I've learned, it's been helpful to a lot of patients too.
100%. It's
You figure out how to travel across country, who's got what treatments where, who should I speak to? And when I talk about resource management too, I'm talking about social workers too. Sometimes you're going to get discouraged at the limited number of resources that they have. But I will tell you that for every 10 social workers, there's one out there that just has the myriad wall of information at their fingertips, just waiting for you to stop by. So go see a social worker at your local health institution, at your local cancer center, at your local cancer group facilitator, and they might have something that can help you.
I would also add too that I grew up in the big city, so I'm not used to people being so nice. This is like the nicest group. Everyone is so kind. I mean, when people say things, there's no judgment. You know, people are super supportive. Everybody is very so open and willing with their own journey and help. So don't be afraid, because what I feel like sometimes what I'm running across is, especially newer patients, our disease is kind of like this weird, exotic Lamborghini disease that no one has, kind of a thing. But all your doctors locally are Toyota dealers. Do you know what I mean? And they don't know how to work on the Lamborghini. You know? And so, you know, you got to join the club, right? And so that would be my only encouragement.
That's good advice, Lon.
I have nothing else to say. I'm going to go catch a plane. These guys got everything.
Thank you, Lon.
James?
Excuse me.
Okay, at least. It works now. No, it doesn't? Well, then this is fun. So, I'm going to turn it off. I would like to know if there are any questions from the audience, but you do need to come to the podium to ask them. I know we have a couple of newer people. We have a panel who has gone through significant treatments, so if you have questions, now would be a really good time to ask them. Would you mind coming to the podium? No problem.
So we just came out of the patient support group, and there was one question I wanted to bring up, but we ran out of time. And the consensus in the room was that early detection is really, really important in treating this disease. I would say about a year after I was diagnosed, I finally found out some of the symptoms I had 6 months before I was diagnosed, and that was night sweats. And I had and Locke kind of made a comment about self-diagnosis, and I self-diagnosed myself, and it cost me 6 months. So I was wondering if anybody on the panel had a similar situation where a year after or 6 months after you found out about symptoms you had 6 months prior.
Well, as I mentioned, I had this terrible cough, and it was really, I describe it as ferocious. Like, it was lifting me off the ground. I had such a terrible cough. And, come on, Mary, you don't just walk around with a cough like that. But it was COVID time, so, I thought, well, maybe it's related.
Self-diagnosis,
and even my
yeah.
doctor, I had an appointment with my primary care physician, and I went to the building, and there was an urgent care in the same building. And when, at that time, being COVID, I entered the building to meet with my primary care physician, and they said, have you had this symptom, that symptom, a cough? And I said, I'm here to see my primary care physician because I have a terrible cough. And they wouldn't let me in. They sent me to the urgent care in the same building for another COVID test. So that's why I say I had so many COVID tests. So I did lose some time. And then, primary care physician, that's not where her mind is going to go. It's an allergy, it's asthma, as you mentioned. So yeah, it cost me some time, but I still feel like maybe I was on the early end.
Okay.
That's a really great question. By the way, I'm Maggie. I'm a pleural and pericardial mesothelioma warrior. And I have it's been 8 years since my diagnosis, but I had some early symptoms. I had extreme fatigue, and I chalked it up to working. And I had recently started a new job, and it was 24/7 operational, so I was going in at various times, trying to meet with everybody in the 2 plants that I managed. And so I chalked it up to that. I just thought I was tired from working. But looking back, it definitely was the start of it. And I think I had some shortness of breath as well. I played soccer almost my whole life. I played a lot of sports. So I should have, I should on myself. But looking back now, I definitely, if I was paying more attention to my body, I would have gotten into the doctor sooner.
And you were young too when you were diagnosed, right,
Yeah,
Maggie?
I was just turned 35 when I was diagnosed.
Yeah, it's kind of, Rich, it's kind of funny that you mentioned that because I had reflected back to see if there was any inconsistencies in how I felt or anything like that. And one of the things that I had come to think about was I started to slow down production at work. And it wasn't deliberate, it was that I wasn't just as fast as I used to be. And there was one time in particular where I took my kids to the beach, and I was a little bit slower than usual going across the beach, walking my kids. And I was a little bit out of breath. And I didn't really think too much of it at the time. And a couple months later, I was diagnosed with mesothelioma. But even with that said, I know that early detection is key to be able to treat very successfully. However, through the foundation and the network of trained professionals within the disease, even if you're stage 4 or have later disease, there are some good things going on, and I commend all the medical professionals that are really pushing the boundaries of research.
Yeah, absolutely. When I was first diagnosed, there was just one FDA-approved treatment, and at least now we have 2. So the stats, I wanted to mention this too, the stats, if you're like all of us that newly diagnosed, you're up late at night, you're Googling, and the stats are horrible, but you have to keep in mind that those stats are old data. They take like 10 years to publish them. So once they're published, they're already not accurate. So don't believe that the internet lies. Don't believe everything that you read. There's a lot of hope.
Yeah.
I think to that point, and the microphone does work now for the last year. Okay, no? It is
Excuse
on
me.
now? Okay. Just forget it. I do want to put this on record because Sue Ellen yesterday talked about an article called "The Median Isn't the Message." And part of this, when you are reading studies, the concept of a median just means that out of all the people who were in the study, half were below the median and the other half were above the median. So when you're thinking about that, think of it that way. There are, a 12-month median survival means that you can have people who are living many, many years longer. So when you're seeing these new studies come out that show, 1 month improvement in median survival, that may seem irrelevant, and why are we even reporting that? But that 1 month required that many people to be on the other side of that middle median. So just remember that also when you're Googling, try to Google that article, "The Median Isn't the Message." I think that speaks a lot.
Stephen J. Gould.
That's him, Stephen J. Gould. That's right, and I had forgotten his name. Could you take us for a few minutes, because I know your treatments were grueling, and each one of you could probably talk about that for a couple of days, but could you take us through some of the most important parts of your treatments so that as patients are being told that they have mesothelioma, and as they're told, okay, here is your protocol, so what should they expect?
Well, I guess I'll start again. My treatment actually has been pretty much a textbook example. In fact, I had that confirmed over the last few days when our medical professionals were talking about treatment. I did the typical 6 rounds of cisplatin and pemetrexed at the beginning. And I won't lie, my first treatment, I really thought I was going to die. In fact, I ended up in the hospital after my first treatment. I was so sick and debilitated, and I was really scared. But once we dialed in good anti-nausea for me, that was a real turning point, and we figured that out pretty quickly. So those first six treatments with the cisplatin, which is tough stuff, I made it through. So I'm just shy of 2.5 years being treated, and I'm on a maintenance regimen of pemetrexed alternating with bevacizumab. And the reason we alternate them is the cisplatin caused me kidney damage. So now we're alternating every 3 weeks. I receive 1 drug in an effort to minimize kidney damage. But CT scans are all really good. They show continued shrinkage in most of the tumors and stability in the others. So it's really working. So I'm a really, who coined the term for us, the lucky, unlucky person.
Thank you. One of the things for me that was important was to be able to find a medical professional that I trusted and that I could work with to be able to plan in terms of expectations. And one of the things that we came up with primarily was a regimen of chemotherapy, which was a standard of care, which was cisplatin and Alimta at the time. And that was to determine whether or not I was a responder to chemotherapy. And at that time, I listened to all the side effects, everything that I should expect, and I was very trusting of my medical provider and didn't really have an issue because anything that we had discussed either came up or did not, and I was able to overcome every obstacle within chemo. Unfortunately, it didn't really have the reduction effect that I was hoping for, and it was on to phase 2, which was surgery. Surgery, I decided to go out to Boston at Brigham and Women's, where they performed a pleurectomy on my right side. And again, before I underwent the procedure, I knew what to expect. I knew that they would be cutting into me. I knew that they would be taking out some of my tissue and then sewing me back up. They told me what to expect in terms of pain levels. They told me how they would help me. And I understood that very thoroughly. When I came back, I was going to do more chemotherapy, but just because I was not a responder on my first set of rounds, it may not be as helpful as radiation. I had mediastinal radiation to the center of my chest because I had involvement with lymph nodes on my pillar areas. And that was where my expectations were a little bit skewed. Because you would go into a room and you would sit there. You would see no knives, you had no IVs, but something was definitely changing. And I could feel it after about the third time. And it's like, there is something definitely happening to me that I hope is benefiting me in terms of long-term survival. So that was where my expectations were off a little bit in terms of patient care. After my radiation, which was probably the most challenging for me overall, but I still worked through it. I was employed with General Motors at the time, and I would go from work to the radiation clinic and then back to work the next day, over and over and over 30 times. The next part, to hedge my bets, I found a phase 2 trial at Memorial Sloan Kettering out in New York City. Through resource management, I found a way to travel out there every 2 weeks, and I was traveling as close to $0 as possible, and was part of the phase 2 trial for the WT1 peptide serum. And it was a blinded study, and the only thing I knew is that they gave an immuno booster, as well as maybe a placebo or the medication itself. So either way, I was getting some type of boost in my immune system. So I knew what to expect there as well. Either I did or did not get it. And I trusted my oncologist at Memorial Sloan Kettering as well, so my expectations matched. And I think that's what's important, is that you go in with a person who is very trustworthy, that you feel comfortable with, and understand the potential outcomes.
Yeah, when I was first diagnosed, the first doctor that I went to said that I did not have mesothelioma because I was not a 75-year-old male and I didn't work in a shipyard. So it is okay to fire doctors. and you really do have to create a partnership with not only the doctor, but the rest of the staff too, because the radiology department needs to know how to read our scans. The oncologist needs to know how to treat mesothelioma. So it's not just one person, it's a big team. And I was a candidate for surgery, so I had the radical PD surgery. And on my PET scan that I had right before the surgery, like a couple days before the surgery, they only saw the one massive tumor that I had, and then a couple little ones at the lower end of my lung. However, once they opened me up, they found it in my pericardium, in my heart, in my diaphragm, more on my lung. They took part of my lung. And so it was a really, really painful surgery. I still have pain today from it, but I'm still here, so that's okay. It was a really hard recovery time. I remember there was things that I would have liked to have known about the surgery, like not to lay flat. That was not told to me after the surgery, or if it was, I definitely missed that. So, sleeping in a lazy boy was probably the easiest way for me to sleep right after the surgery. And I also did IVF in between surgery and chemo to help preserve fertility. So if that is something that, interests you, talk to your doctor about it and make sure that you at least get those questions answered. Ironically, the insurance company paid for it because I was considered terminal, but I was able to harvest three embryos. And then after that, I did the chemo, both cisplatin and Alimta, and I did 4 rounds, 3 weeks apart. And I would say the first one was probably the most difficult until they get the medications right for the side effects. I remember I had to get the Magic mouthwash because I had the ulcers inside my mouth. And then I was really fatigued. I slept for like 5 days after a treatment. But yeah.
Yeah, thank you so much for sharing. Is there a patient with peritoneal mesothelioma who would also like to share their treatment story? Come on up. Rich?
Oh, me.
You nodded.
I thought you were talking to somebody behind.
Unless there is somebody else too. We had to reshuffle our panel a little bit, but I do want that experience also to be recorded.
I'm kind of an old timer here, so I'd like to hear somebody.
Yeah, please, come on up.
Here, I'll tap out because mine's easy.
Sure.
Hi, I'm Rohan. I was diagnosed a year and change ago in May of 2022. Had a couple bouts of abdominal pain. It was probably, it was episodic, so I had some abdominal pain. Went to the ED, didn't find anything, kind of that same story. And then the second bout of abdominal pain was kind of exactly the same. I was 35, completely otherwise healthy, so it was I was used to getting discounted by doctors in general, and their alarm bells weren't really ringing. Abdominal pain didn't really scare them in any ways. My liver enzymes were a little high. I said, you have a fatty liver, everybody has that. But then the second time when it was exact same, I was a little more aggressive about getting an answer. So my appendix was inflamed. They went in to take it out, and that's when they saw it. Biopsies, if you had it biopsied where it wasn't sure, a confirmatory test, the whole route of, I'm sure we've all been down that road of, don't worry, we're going to see what the next person says. After 4 or 5 of those, you've got the 1 in a million disease. So I talked to a bunch of experts and, talked to 10 experts, got 10 different treatment plans with 10 justifications that they all make sound like it's completely reasonable. So at the end of the day, you pick something that works for you, your family, where you guys are, the support group you have. And so I had cytoreductive surgery in HIPEC with Dr. Alexander in New Jersey. He's now at Rutgers. Maybe 2 months after my surgery, they were able to bring my score down to 0. I was in a little gray areas with regards to my PCI score and my lymph node involvement. So after talking with him and Dr. San at the NIH, it was basically up to us whether or not I wanted to do chemo or not, and just because of the side effects and the risks involved, they said surveillance was a totally acceptable plan, so we kind of went with that. So right now, unfortunately, I'm having a little more abdominal. I mean, I was doing okay with the scans. There was a little something here, a little something there, but in the past week or 2, blood work doesn't look so, it's not ideal, basically, having a little more pain. So I'm set for another just diagnostic laparoscopy, just to take a look, get an answer, and go for that next week. So not a great time, but so as far as I've gone, I think my surgery in HIPEC went about as good as it can go. No hiccups. spent 5 days in the hospital, which was expected. They got everything they could. So in that sense, it was great. And then it was kind of just a wait and see approach. So hopefully this isn't a step back, but I guess we have tools in the toolbox in case I need to do another treatment, and hopefully those will all be hiccup free. But I guess, it's kind of like it's just the road we have to kind of go down eventually. So that's basically my story in the past year and change. So.
So don't be shy. Does anybody have any questions for our panelists or for anybody else in the room? Everybody got quiet. So, as is customary, we are running out of time and even a little bit late, but this was our last presentation today. So I guess I have the distinct pleasure of closing this conference, which I shouldn't be, but because I'm not prepared for that. But I just want to thank all of you for coming here, for traveling, for taking time out of your lives to be here. I do also want to thank everybody who is watching online, because luckily technology has improved leaps and bounds since we were last together, even in for a 3-day conference, which was in 2019. We were back together in 2022 as well. I hope that we can continue this community that brought us here this week back online, as we have been doing throughout the last 4 years. And please stay in touch, stay connected. We will keep you posted on our next plans for our next get-together, conference, advocacy day, and also any action items, action alerts, especially as it relates to our advocacy from this week. So once again, thank you so much for being here, and I hope to see all of you soon.